Good morning, everyone. So, I'm back again to talk to you just about three things really this morning. I've not done a Facebook Live. Apologies if you've been waiting. So, three things: the government response, what's happening in dentistry, and how that's changing my practice. So the government yesterday announced school closures. I guess that's the biggest news, isn't it? Because it's going to change the way we work. They've said that schools will close to all but key workers, and we're not, as far as I can tell, considered key workers. In fact, I guess that I'm expecting them to close us down pretty much. This morning they've announced that they will release the list of key workers, and that's to include also delivery drivers, as well as people that run the infrastructure of the hospitals, as well as the obvious doctors and nurses that are essential workers without a doubt. I doubt very much that dentists will be in that list, and I guess really they should keep us away from treating the general public if we are to really enforce the social distancing model that they're working towards. I guess on the devil again is in the detail, and we look forward to that list that's going to come out, and that will give us that clarity that we need. Now, schools are going to stay open for the children of those key workers, and as far as I can understand it, it makes more sense to put children in local schools rather than their own schools, but that might be logistically very difficult with DBS and safeguarding and all the rest of those things that schools have to look at. So it may be that you still have to drop your kids to their school, and there'll be a amalgamated class in the sports hall, as if there was a rain day or a snow day, and kids will be taught together, and I think it'll be a lot more arts and crafts based rather than real teaching. That's my understanding anyway. The second thing I want to talk to you about is what's the impact for dentistry? Well, first of all, let's see how and if we are considered key workers. I expect not, so that we can then be used, hopefully, in any response. If the pandemic is as bad as it's going to be, then maybe they will draft us in as recruits to help in the triaging of patients, or whatever is needed to assist. Surely we can help with cross-infection, but I don't know. I really don't know, and I guess there would have to be some further training. So we're waiting for the list. We haven't still had any further concrete guidance from the Chief Dental Officer, and I'll put my hand up and say that I was probably a bit harsh to her. They are probably going through lots and lots of discussions, and there are lots of moving parts within this. We definitely don't have the full story and all the information, so we have to really defer to their judgment. And I'm sure if Sarah Hurley was able to talk directly to us, I'm sure she would. I really think that there are powers that be that and things at play that are outside of our purview, certainly. So let's wait and see what comes out in the intermediary time. I think we've got an option to not be told what to do, and maybe that's a benefit for us. So we can use our clinical judgment. We can do what we need to do to maintain our businesses, and let's hope that when the guidance does come, it's not too restrictive. I don't know. The third thing, how does this affect my business and my practice? So after a nearly 2-hour call with my practice manager yesterday evening, we decided that we're going to restrict our patients, like some of my colleagues have already done, and really bring it down to quite a core service. We are still going to fit our crowns and things. I think it's not worth my patients being in temporaries over a prolonged period. Those temporaries probably aren't going to last, and I don't want my patients having that extra trouble. So we're going to do some fits. We're going to finish off any simple courses of treatment that we can under rubber dam, and to try and prevent as much aerosol as possible. Obviously, I want to balance protecting my patients, my staff, and keeping the business viable. And it's a personal choice, and I don't expect anyone else to do it the way I've done it, but it's the way I'm going to do it. And I feel I have little option to do that, rather than fully close the practices, emergencies only and lay off my staff. Let's see how it goes. The other thing that I missed out on what the government's done, because just this morning they're talking about a new benefit, to retain workers that pays something like 2/3 of the salary of, they said, 1 million workers. And I don't know if 1 million workers is really enough. I'm sure there are a fair few more than 1 million workers in the economy. So let's wait to see what comes out further on that, and let's appreciate that they are doing a lot of work behind the scenes that we just don't know. I know I said 3 things. The 4th thing I want to talk about is what are we going to do during this period, and how are we going to help and move our community forward? As long as we're fit and able, are we volunteering? Are we assisting in our local community groups? Not necessarily where we work, because we might live many miles away, but certainly on our streets. I've seen some wonderful leaflet drops from a dentist and her husband, who had a reply back from her street when she started a WhatsApp group, and the message that came back was that there was a single mum with a couple of kids, and they're all unwell and they needed help. And the lady who received the message of support was crying out of joy that somebody had bothered to do this. So you don't know your small act of kindness, how it can impact other people's lives in these difficult times. And I think as educated, intelligent, articulate, and we deal with the general public all the time. We have skills that other people don't, and sometimes we don't recognize them because we just do what we do. So I think don't underestimate how much you can do for your community, your people, your locality, your patients. And in some small way, I'm trying to do that and reaching out to everyone online by these videos, and hoping that if I can help you guys with anything, then please just get in touch. I look forward to serving you in any way I can, and let's all pull together and get through this. I look forward to the next video. No, I'd be lying if I said that, and the people that know me would know that I'm not a natural at this, and I'm struggling to do this and pushing myself to do this every day. But I hope that, and I know that I can give some service to people who maybe won't ask me or won't ask for help. So please, if you need anything, I'm always here, even if it's just for a chat. Take care, and I'll speak to you soon.